Welcome back to Midday Kentucky, everyone. It's 12 o'clock, not 9 o'clock. Dr. Ron from Advantage Osteopathic Therapy, Physical Therapy, I should say, and we're talking about his business and what chiropractic services that you have to offer. And I was telling Katie just before the break that you also have a therapy pool in there. Welcome to the show.
Thank you very much.
We love discovering new businesses for us, considering we're also only been in town almost a year now. So what makes your practice different from other chiropractic services?
Well, we're physical therapists,
Physical
though.
therapy.
So, versus chiropractic. But we're all fellowship trained. We have 4 therapists, my wife, Esty, and I, and then 2 other physical therapists who did year-long intensive training programs to earn our fellowships, which is specialization in orthopedic manual therapy.
Well, and I did say chiropractic, but because people do confuse both together. And there are chiropractors that do physical therapy as well. So
That's right, there are some. That's
explain
right.
the difference for that.
So,
maybe I didn't explain myself.
you know,
sorry.
There's a lot of similarities and there's some differences in between the two.
Yep.
Chiropractors definitely focus on the spine first and foremost, as that's their formal training,
Yep.
and then branch out into some of the extremity stuff as well. But in a lot of ways, we treat similar things in somewhat similar manners. We both do some dry needling, which has now been allowed by chiropractors here in town per their Practice Act, or here in Kentucky. We crack necks and backs and joints and all those other things. And I think we as physical therapists across the board tend to focus a lot more heavily on exercise, and then the chiropractors are starting to branch into that as well.
Well, talk to us a little bit more about the specific conditions you're treating. We were talking in the break that a lot of patients will come to you thinking, I'm just here because my doctor is making me, and they don't realize that you can cure injuries or you rehabilitate people. There's a vast array of things people come to you for, right?
That's right, that's right. I mean, we pretty much treat from head to toe and all age ranges. So we treat everything from tendinopathies or tendinitis and bursitis, post-surgery rehabilitation or pre-surgery habilitation, rehabilitation. We treat headaches and back pain and elbow pain, hip pain, knee pain, foot pain, plantar fasciitis, arthritis.
Really?
Yes, absolutely.
Okay. Well, tell us a little bit about, you're saying that all your physical therapists are fellowship trained. What does that mean to us sitting at home watching you?
Right. Fellowship training means that our therapists spent a year-long intensive training program studying research and hands-on manual therapy techniques, so spinal and extremity manipulation, cracking joints like we talked about, dry needling. I have published several articles, my wife has published during our fellowship training. So we have taken our basic PT programming degree and then enhanced it exponentially by learning significant evidence-based, in-depth, hands-on approaches to getting you better faster.
And what's your philosophy or your approach to physical therapy? What led you to be so passionate about it?
Well, I was a PT technician many, many years ago, and then I went and became a state trooper here in Kentucky many years after that. I got into a car wreck probably about 6 months to a year before I left the state police and had to go to physical therapy. So I kind of revisited what I enjoyed doing even years before then. So I thought, you know, I knew something in medicine is where I wanted to be, so that kind of spurred me on to look back into physical therapy.
And I think it also, you know, takes a great person to be able to sit there and listen to people when they come in. They're either in pain or they have an issue. For you to show empathy and show ways on how to fix that must be quite rewarding as well.
It is. You know, I think we would all say that we're part psychologists, you know, because we're dealing with chronic pain and acute pain as well, but a lot of chronic pain. And chronic pain changes how people think and how they view things, and it can be quite debilitating to them.
I got you. Well, we appreciate you coming in. You're going to come in a little bit more often.
We are.
And talk a little bit more in depth about the things that you do over there at your clinic. Now, it is AOPT. Let's put all the information up on the screen right now. Advantage Osteopathic Physical Therapy. There's the website. There's their email. If you want to give Dr. Ron an email, head over there. There's his phone number as well. It is a really great practice. When I came over and had a look, I was quite surprised how big it was in there. Good job, buddy.
Thank you.
Really
Appreciate it.
Thank you for coming in. Look forward to having you.